Hello everyone, welcome to today's training. In today's training, I'm going to share with you the 10 basic first aid tips and procedure during emergency that you need to do. For instance, there is emergency at home or place of work or anywhere. You don't need to seek for nurse or doctor attention. You have to be the nurse at that particular moment. So these are the first aid treatments you do to the person before seeking for expert management by rushing the person to the hospital. I ensure you watch this video to the end so that you won't miss any important information, and don't forget to share, subscribe, like and comment. You can also drop your question if you have any. Thank you and stay tuned. So before we start this topic, I encourage all of you to listen very attentively so that you will get the important information here, and also commit the 10 golden tips of first aid to your brain so that you can use it to save life. It might be relation, family, friends or whoever, so you can save the person's life. Thank you. So what are the 10 first aid tips? Number one is the 3Ps. The 3Ps is the main primary goal for the first aid piece when you want to save someone's life. What the meaning of the 3Ps? It means preserve life, prevent further injury and promote recovery. For instance, during an emergency situation or during an incident like that occur, due to the panic and tension, you won't able to know what to do at that particular time. It's not that you cannot do it, but due to the tension and panic, you will just be running around. For instance, somebody had emergency at home. Some people will be looking for car key for a long time. It's not that you didn't see where the car key is, but instead of you to run around, this thing should remind you of what to do. The first thing that should come into your mind is to preserve that person's life and to prevent further injury, then now promote recovery. How do you do it? What will you do to prevent this person's life? What again will you do to prevent further injury? And how do you promote this person to recover? So that's the number one tips for first aid. So number two tips is when you want to rescue somebody that is in danger in an emergency situation, before you rush to that person to rescue the person, you have to check the environment for danger. How do you check? Identify any danger object that can also put you in trouble or can also harm you, because you won't rush to save another person's life and got injured. For instance, let's just say that in outdoor outside your environment and someone needed your help, and there is a heavy storm and a heavy wind blow and the rain, there was a heavy rain. Let's just say there is a heavy rain and you want to rush out to check, to assist that person, to help that person. You have to check your environment before going. Is there, for instance, if there is a heavy wind blow, you have to check, is there tree around that person that looks like about falling, or structures that looks like this structure is about to fall, or is there like power down line. For instance, in this country, if rain falls, NEPA wires will just be everywhere, naked wire. You have to check all these things. Or is there flood around that area, so that you will not put yourself in danger too, trying to save another person's life. So by doing all this, by identifying the other risk factors in that environment, so you now have the better strategies on how to save the person. So number three tips is on how to treat somebody that have cuts or scrape. For instance, somebody have cuts on his hand or wherever. So how will you now treat the person that have cuts and scrapes? What you need to do is that, as we all know that blood is a vital component of our body, and for you to stop the bleeding, to arrest the bleeding, there are some important things you need to do. Number one is, first of all, to apply pressure on that cut area for like 20 to 30 minutes. After then, use a clean running water to run over the wound and clean the wound. Apply antibiotics ointment. Do not use soap to wash an open wound so that it will not get contaminated. Somebody that has nose bleeding, all you need to do is to instruct the person to lean forward, use a clean cloth against the nose until the blood flow stops. In this case of cut and scrape tips, some small cuts normally heal quickly on its own, but deep cuts required medical at ten tion. So if the person have a deep cut, all you need to do after trying to arrest the bleeding, what you need to do is to transfer the person to the hospital for expert care. Okay, number 4 tips is how do you treat sprain or dislocation, assuming that you're walking on a road and you accidentally miss your step or something like that, and you now have dislocation of the ankle or anywhere. Within that moment, within that few time, you will start experiencing swelling of that area. So what will you do if such a thing occur? Number one is to apply ice on that area. Apply ice pack on that area, but do not apply it direct to that to your skin. Wrap the ice in a wrapper or in any clean object, or you put it in a plastic bag before applying it. Do not apply it direct to the skin. Then this spraying of a thing normally go on its own, but as a result of the blood flow around that area, that's what cause swelling in that area. So you have to elevate the affected limbs. Let for instance it happen on the leg, so you have to elevate the legs on pillow, because if you keep the leg without elevating it, the swelling will not reduce. So you have to elevate the leg on pillow, apply the ice, then at interval you do compress the area. When you compress the area at interval, you apply the ice. So do not use the ice to wrap it very tight, and also make sure you put the ice in a plastic bag. Don't apply it direct to the skin. Number 5 points of first aid is how to treat heat exhaustion. Some of you might be which one is heat exhaustion? Yes, heat exhaustion is also an emergency need emergency treatment. It need an urgent treatment. Heat exhaustion occur as a result of prolonged exposure to high temperature, especially those strenuous activities. So what are the signs and symptoms of heat exhaustion? A person may be feeling cold, moisture skin, sweating profusely, heavy sweating, feeling of dizziness, muscle cramps, feeling of nausea and headache. You feel like vomiting, you cannot vomit, you are having headache. Is as a result of heat exhaustion, because and again the person has not even taken enough water and he has been working for a long time and exposed him or herself at a high temperature. So the person can experience heat exhaustion, and it requires immediate attention. So how do you treat the person with heat exhaustion? The just few things that you have to do here: take the person to a shaded area, as in bring the person out from the sun light. Then if there is no shaded area in that place, just provide any available material that can cover the person from the sun. Then give the person enough water to take. Make sure you hydrate the person very well. Place a cold cloth on the person's forehead to lower the body temperature. So number 6 points of first aid that you can do at home is how to treat hypothermia. Hypothermia occur as a result of prolonged exposure to cold temperature. when your normal body temperature drop from normal to abnormal, like from drop between 95 degree Fahrenheit or 35.5 degree centigrade, is now getting to hypothermia. Your body temperature is now abnormal. Is a cause for alarm. Is an emergency cause. Is an emergency situation that needs treatment. Signs and symptoms of hypothermia. Number one is shivering. Like you'll be feeling shivery very well, and you also have mumbling speech, like you want to talk, your teeth will just be shaking, you cannot even talk very well. Weak pulse, you're having a weak coordination, you feel like confusion, red cold skin, and then loss of consciousness is as a result of hypothermia. So all these things need immediate attention. So what are the treatment of hypothermia? The treatment of hypothermia include the following: be gentle with the affected person. Don't rub the body or don't move the body in a jerky way, so that it couldn't trigger cardiac arrest. Just move the person out of the cold area, and then remove any wet cloth if the person is putting on, if the cloth is wet already. So cover the person with extra clothing or blanket. You can use a heat pack. Do not apply it directly to the person's skin, so that it do not cause skin damage. Then give the person warm fluid such as water or warm tea. So if you set the person on the floor, on the ground, so the floor might also be a source of cold body temperature. So what you need to do is to place warm material on the floor before the person can lie on the floor. So these are the treatments of hypothermia. 7 tips is treating burns. So how do you treat a patient that someone that sustained burns? So before treating burns, before applying treatment on burns or patients, you have to identify the types of burns and the severity. So we have 4 types of burns. We have the first degree burns. Only the outer layer of the skin are affected. There might be swollen or reddish of the skin, so it just looks like a sunburn. The second degree burns, that the inner layer of the skin, both the outer and the inner layer of the skin is also affected. Just look, there is also blistering the skin, and the skin is also swollen. This is usually very painful because of the inner layer of the skin that is affected. The third degree also has to do with all of the inner layers, they are also affected. So the wound has whitish or black end color. Sorry, excuse me. The wound has blackish or white end colors. In some third degree, the burns are so deep that the person might not even feel any pains, because the nerve ends are destroyed. So the person might not feel any pains on the third degree because the nerve ends are destroyed already. So the fourth degree of burn has to do with the burns penetrate all the tissues up to the tendon and bones. So additionally, we also have 2 kinds of burns. Severity, that is the minor and the major. The minor severity has to do with the first degree burn and the mild of the second degree burns. Major burns, the major burns severity, like I said, we have the 2 kinds of burn severity, the minor and the major. So now the major burns severity has to do with the moderate second degree burns to the 4th degree burns. So how do you treat major burns? Major burns are serious injuries that need medical attention as soon as possible. So what do you have to do to help someone that sustained major burns? Number one is that you should not apply ointment on the area. Just cover the wound with loose cloth material to prevent infection and transfer the person to the hospital immediately. So number 8 point of first aid is allergic reaction. First of all, what is allergic reaction? Allergic reaction occur as a result of your body being hypersensitive to food substance, drug substance, or anything that your body reacts to. Is called the allergic reactions, and you will get all these things from food ingredients or drugs. So they are also an emergency case. To treat allergic reaction is by the use of auto injection called epinephrine or adrenaline, but mostly these drugs are not readily available at home or at the pharmacy, or is always available in the hospital. So when the person that is reacting to any food substance or drug substance is taken to hospital, the first thing is to calm the person down, and then as if the person have used adrenaline before, or if the relative have one with them. So you have to lay the person by his or her back, elevate the feet to 12 inches, make sure you lose their tightened clothing so that the person can breathe very well. So after administering the epinephrine as prescribed, you wait for like 5 to 15 minutes and check if the effect of allergic reaction has subdued. So if there is still effect of allergic reaction, if that has not stopped, so you have to give second dose. The second dose of epinephrine or adrenaline is required until you make sure that you've stabilized the person. So that is all about allergic reaction and its treatment. So number 9 first aid tips is how do you treat fracture. At times we can easily identify or notice that someone has fracture, but sometimes you may not identify it. So when you suspect that somebody has fracture, please, all you need to do is don't try to straighten the affected area, maybe the leg or and don't try to straighten the area. So what you need to do is to immobilize the limbs. Don't move around, don't ambulate around. So keep the affected area from moving. So apply ice pack on the affected area. Please don't apply it direct to the skin. You can use a wrapper to wrap it, and then or you put it in a plastic bag before applying it. Then elevate the leg on pillow to avoid more inflammation, to avoid much swelling around that area. So give the person prescribe anti-inflammatory drugs such as ibuprofen or paracetamol just to relieve the pain. Also use splint or padding to stabilize the area. Ensure you keep that area from moving. Number 10 point and the last tip for first aid treatment is CPR. CPR simply means cardiopulmonary resuscitation. CPR is used to restore breathing and blood circulation to an unresponsive person. So CPR is an incredible important procedure that saves lives. So in our next video we are going to do practical about CPR, how to save life using CPR. So ensure you subscribe to our channel and don't forget to turn on the notification bell so that you'll be the first person to be notified about the next video. And share this video if you find it more interesting. Like, comment and drop your question. Thank you for watching. See you next. Bye.